Good Saturday morning, everyone. Wynn Brown with our Heywood update for March 19th. Meant to get it to you yesterday. Actually, I did shoot it. Something technically happened, so I'm redoing it again this morning. So you're catching me in my Saturday morning attire. I got my favorite GFA top on as well. Favorite credit union, obviously in our region and across the state. Just an update on our COVID testing. Obviously, you're aware that the prevalence is down, which is great. We've done 151,000 specimen tests. Our positivity rate is 9.2%, and the state is 4% over the course of the pandemic. Our 7-day average is 6.42. The state's at 1.53. I will say that the number of tests that we're doing are lower than they have been previously, so that percentage does pop up a little bit that way statistically. We have 3 COVID positive inpatients at Heywood Healthcare, and our community average is 8 per 100,000, down 3.3 points, and the state is at 9.7. So we're falling right in line with the state, and there's this great graph that I've shown you before here that shows you the most recent surge and how we've come down nicely. Still need to be really smart and be careful out there, folks. Just an update on visitation at Heywood Healthcare. So effective Monday, March 21st, which would be 2 days from now, you're allowed to have 2 healthy visitors per patient. And in our ambulatory and perioperative services will be 1 healthy visitor per patient. There are exceptions, of course, to every rule. That's around pediatrics, of course, and around end-of-life comfort care. And those are also, if someone is under investigation as an inpatient for COVID-19 until they're ruled in or ruled out, the visitation is restricted there just for that time, unless it is, again, end-of-life care or pediatrics. Just a reminder to our staff that all booster eligible employees are expected to receive their booster by close of business on Monday, March 21st, or have established an alternative deadline with employee health for COVID-19. Over the next 4 weeks, managers will be scheduling one-to-one meetings with employees who have not yet gotten their booster to make sure that that requirement gets satisfied. And there's a handful, I'd say a large handful, but a handful of staff who have not yet got their booster. So we're going to be working with each one of them individually to get that taken care of. Just a reminder that drilling and blasting on the Heywood campus on the south side, where we have cleared the land to the left of Heywood Hospital, begins next week. So there will be blasting that happens. I think all of you who live in the area or who've been at Heywood a long time know there's a lot of ledge on that side of our campus. So the warning signals are 3 long horns happen 5 minutes before blasting, 2 short horns 1 minute before blasting, and then 1 horn afterwards as an all clear. So just keep your ear to the ground on that. So just want to make sure everybody's aware of that. So as part of that, effective Monday the 28th, all campus employee parking will be significantly decreased because we're going to be closing that lot. So please know that you can park on Green Street, you can park on Matthews Street, and we have a regular shuttle service running to Mount Wachusett. All leadership will be using the Mount Wachusett campus to show everybody how it's done. And we're really encouraging everybody to park at Mount Wachusett if possible, because we need to save space on campus, 1, for our patients, and then 2, for second and third shifts so that they can be parked on campus so that, when it's later or darker and they're finishing their shifts, they don't have to be shuttled anywhere or just not feel comfortable with where they are. So we need to think about everybody. This is the big royal we that we need to think about as we do this through the summer. The medical staff is in the exact same position. There's no reserved medical staff parking as well. So making sure that we do all that. The parking plan will be coming out next week. We just refreshed the map, so you'll be able to see everything. There's a couple pictures here. One of Rachel Casey, who's our lead with Colliers, who helps us with construction, and Elaine site work. Jared Elaine is there as well, looking at the site last week. And if you want to see what's going on right outside facilities office, there's a whole bulletin board dedicated to the surgical pavilion, the timeline, the layout, the rendering. So take a look at that if you want to slip through the back hallway. We had fun on St. Patrick's Day. We went across to our partial hospital program and recognized John Marcinkevich for stepping out for service as our Employee of the Month. So that was fun to do. John's a long-term valued employee at Heywood Healthcare, a member of the President's Advisory Council as well. So it was fun to recognize him and drop off the super huge cupcakes and some flowers and a sign as well. And his picture will be up on the wall outside the cafeteria at Heywood shortly. And just from Jillian Hillman, who leads us on our wellness, encouraging everybody to take your lunch break and get outside now that the weather is good. And so she did include a picture of Caitlin and Maureen out for a walk at lunchtime. So stay healthy and take advantage of all the things. On Monday, it'll be Meditation Monday, and there'll be a 5-minute meditation that you could do when you wake up, on your break, after work, something great that we do. Just a reminder that National Doctors Day, and we will celebrate that, is coming on March 30th. And so we actually have a gift program for the community to honor their favorite physicians and say thank you with that. And then, of course, we have the Daisy Award is going on right now, and you can nominate a nurse at Athol Hospital. And for those of you aware of the Daisy program, recognition program, that is actually an international program, and it's a huge award given out in hospitals around the country, representing incredible nursing care. Our past recipients are Jill Sherman in oncology, Bethany Maselli in the ER, Carol Vidalius in the ER, and Ross Aries on Med-Surg. And there's a link for more information and an easy link to send your nomination right there. To save the dates, Relay for Life, June 10th, sign up for our team. Our Heywood Shuffle, replacing our gala, a fun event that we're doing. Click on there for Friday, May 20th, and find out about it. Our Golf Classic at Athol in August on the 8th, Ride for Your Life, August 21st. The Heywood Golf Classic on the 12th, and Healthy Harvest 5K. Get outside and get ready. Saturday, September 17th, earlier in the fall. So hopefully it'll be warm and lovely. Just a reminder that if you're not getting your vaccine booster at Heywood as an employee, CVS and Walgreens have them, and there's some links as well. And if you need to pause and take care of yourself and you need some support, the behavioral health support to help you, obviously you can reach out to the Quabbin Retreat and clinical support options, and everything's there. Obviously our career openings are there as well, and so I encourage you to take a look if you want to move within the healthcare family, or you want to share that with friends and colleagues from elsewhere that you think might want to join our team as we continue our journey to be one of the best community health systems in America. Have a great weekend, everyone.